in one by one this morning. It is 10 o'clock and we have quite a few things on the agenda today. So I am going to go on ahead and actually get started so that, and people can chime in as they will. For those of you who are new to this format, to this platform, I am Sharon Tubbs. I am the director for Health Visions Midwest. We have been coming together for years and networking and gathering with people in the social service and human services realm to learn from one another, do presentations, and to network and get to know what each other is doing. And so we've been doing it virtually, of course, since COVID changed our way of life, but we found that it has been beneficial and people still have been going on. I don't see as many people, like people are still home and resting up from their turkey apparently, but again, they will stream in. For those of you who are new, we are a faith-based agency, and so we do begin our meetings with a prayer or meditation. However, if you're not into that, we totally respect that. No worries. Just turn down your volume for the next minute or so, or do the, turn off your video, and we are totally fine with that. But we are going to begin with a meditation. Okay, Felicia, our director, Juanita Boland in, what is that, Hammond, she cannot hear anyone. Can you help her out? I don't know what's going on. Can everybody hear me?
Yeah.
Okay, so it may be, Juanita, it might be you. You might need to turn up your volume. So we're going to start out with this quick meditation. And I thought that since we are in the holiday season, it would be good to think on a couple of things. And so what I want to do is take just like 15 seconds. 15 seconds. And I want you to think about your biggest blessing of the year. What is the biggest, I mean, like, not that blessings can be ranked, they're all good and wonderful, but just think in your mind about one of your biggest blessings this year. If you can share in the chat, if you feel comfortable doing that, please do. Start now. Big blessing. Nobody's been blessed, apparently. Okay, here they come rolling in. Okay, so the birth of our daughter in July, John Miller, awesome. That is such a blessing. Both of my sons are feeling more comfortable on their college campuses. That is awesome. Mary is a, what do you call that? Empty nester. So she's struggling, y'all. No chemo radiation after breast cancer diagnosis. Yay, yay, yay. Able to work in a team with other providers to help my clients. That's Lupita. That's our girl. You're going to hear from her in just a second. To connecting with my purpose, understanding I was created to fulfill it. Ooh, Marquita, she is awesome. Birth of my first child. Oh, grandchild. Okay. Yes, yes. And thank you. Family. I feel the same way, Diane, Dr. Diane. I think my biggest blessing is just my family, not just, but just my family and parents who are still living. Daughter married to a great guy. That's important. Not that she just got married, but she got married to somebody great. Okay, that's what we want. Deb Lulling, family, I'm right there with you. Mindy, absolutely wonderful and supportive new health commissioner. Okay, Dr. Gutwein. Mindy is with the Allen County Department of Health. Wonderful. Kiona, still having my family here and my mother. Yes, yes, I feel the same way. Family and friends. Hello, everyone. Joseph is saying, hi, Joe. We were just talking about blessings this year in this season for our meditation. Kim is thankful for working with a great boss and group. Very supportive husband. Yes. Okay, I want one of those. So yes, we have got, I'm not married, y'all, so I'm not dissing my husband or anything. Just to clarify. So we have some great blessings that we are thinking about this season. And so I'm just going to say just a quick few words, just a quick meditation about that. And here we go. Sometimes we get too caught up in holiday commercialism. Today, let's refocus our hearts and remember why we're celebrating this season. Renew in our hearts the wonder and awe of the miracles of the gift of Christmas. Not only us, Lord, but let our newfound wonder spread to our families and our friends. Let us come together to celebrate you and leave behind the fuss. All right. So that was just a quick moment of meditation to get us thinking about what is important. I noticed when we were talking about blessings, nobody said my new flat screen TV. Nobody talked about the new leather pants that they got or any of those things. So what is most important are those things that we hold dear in our hearts and those things that we really do consider blessings. So thank you all for sharing this morning. And now another blessing is some of the information that we're going to get this morning. We're going to start out with our own Lupita Valdez. She is our Latina community health worker. And then we're going to have our main feature presentation by workers from Brightpoint who are going to tell us about some of their services. So we got two things going on today. Thank you all for coming. And Lupita is going to share some information about our Latino outreach program, okay, that she has been doing a bang up job with. I don't know if you all know Lupita, but she is phenomenal and she has done a lot of outreach in the community. So Lupita, all on you.
Hi, everybody. I'm Lupita Valdez, and I'm the community health worker from Health Visions. I have working here around 1.5 years. Before working here, I was comfortable in a job that I had already for 10 years, like subcontractor for DCS. And when I saw about this job, I just said, that is God designed it for me. I came and applied, and I got the position, and I think has been an certain move in my career because I really love the things we can do for clients in this agency. I work with the Latino community, with all the people that does not speak English. Someone speaks some English, and I do all kind of things with them. First, one of the things that I do is interpretation for them. I help them with medical interpretations that can be from going with them to a medical setting where I interpret for them. And many times it's not only interpretation, I am advocating for them with the providers. I also help them in work interviews. I also do translation, like help them to do a resume. When I take them to a job, I also am advocating for them. Sometimes even I contact the employer ahead, so then they know me. So then when my client go, they have like a more knowing about them, because I try to sell my clients like for they could get the jobs. And seems like we are having a lot of success in that. I also help interpreting for clients in the schools, and I am advocating for clients for their children. So basically is medical settings, can be works, can be on school, but also something I do a lot is help them with financial aid applications, or to contacting the accounting department where they have big bills that is overwhelming them. And I think all this part of the interpretations that I'm doing is some kind of help to their mental health, because people get overwhelmed when they are ill, when they don't understand what they have, when they have these bills accumulating, and even the client to go to have the medical care they need because of the bills that they're gonna get. So, so then basically that is part of what I do in interpretations and translations for them. And does include a lot of advocating for them too. Even sometimes it's collecting like a lot of medical information from them ahead. So then when they go to the doctor, since the doctor has limited time to see them, can help them to have the right test done. And that is part of what I do with regarding interpretations. Felicia, we can move to the next slide. We also have classes of health, and these classes of health are about chronic disease. You name it, can be whatever kind of cancer, nutrition, obesity, diabetes, high blood pressure. When they come to the classes, we have incentives for them. We have two kinds of incentives. One is these gift cards from Walmart that we give clients like are for $5, but we have also vouchers for food bank for those that are on need. And people like and get help a lot from these vouchers for the food bank because they basically go to get their groceries for at least a week. With a couple classes they do, they get like 50 pounds voucher, and they get food and other things named it freeway, that after they get their 50 pounds, they get vegetables, fruits, bread, lactose, all that stuff like, and there's not a limit of how much they take. They can take whatever they need. So then that is regarding the classes we have here on Health Visions for clients about chronic disease. Other thing that we do over here that I like a lot is a program that I created, is named Tú No Estás Sola. And it's a support group for Latino women that provide them a safe space to talk about adverse events they confronted in the past or they are currently experiencing. The women that come to this group, they have experienced abuse, neglect, and challenge at their homes when they were growing. Some other ones still confronting this challenge, like abandonment, like domestic violence. So then this is a safe space where they can come, they talk about what is bothering them or what they have been keeping in their heart without saying it to anyone for a long time. And this safe space is a relief for them because sometimes people has been keeping all these suffering they have gone through or the abuse of neglect like a secret. And for example, I have a client that told us her story about how she traveled from Mexico with the father here to New York. And when they were in New York, the father just left her there with the guy that told her was his uncle, but was not really the uncle. And the father came back to Mexico and left this girl here being 15 years old, told her, you're gonna have to work and ship the money to Mexico. And well, this uncle that was not the uncle, if not somebody that the father contacted, like from the same town, and he was sexual abused this girl for a long period of time. And when this girl wanted to stop the abuse, this guy just put her on the streets on New York in the middle of the night. And from there, this girl was homeless, walking through the streets from New York through the night, trying to open the doors of the cars to have a place where to sleep. And she went to a lot of abuse while being on the streets, sexual abuse over and over by people. And here through this program of Tú No Estás Sola, she talked about all this, and she said that this was something she has kept on secret by 30 years without saying it or disclosing it to no one. So then I think it's a good program where women don't come only to talk about all the bad and traumatic experience they have been confronting. If not, this is a place where we can empower them, and they can learn also that they are not the only people has gone through that, since all the women in this group has gone through similar stuff. So then sometimes people tend to think that the bad things happen to them is because it's life, if not because they were full or they got into that situation by themselves and they carry all this guilt feeling on themselves. So then here they connect with other women that has experience through the same, and through the experience of other women, they can understand that what they were that they were victims, and not that they were a fool, like, and got into that situation because of themselves. Women here receive emotional support and are empowered to live a healthy life. They are referred to other social services agencies, like, for example, they could have counseling. And I connect them with other agencies in the community so they could have some other kind of support they need. So then we have the support group a day, and then a couple days later, we complement the support group with another activity that we name Healing and Breakfast. It's a wellness activity. We meet and they learn all kinds of things. They release the stress. We share a buffet meal that everybody brings something. So then we make it a buffet and everybody eat together. They learn life skills. For example, I don't tell them we meet in my office. So I tell them we're gonna meet maybe in the mall or in a park. And believe it or not, even when these ladies has been here like by 20 years, they even never been in the children's zoo. So I put on their phones the application for the GPS, and I teach them to follow a GPS to go to the places they have to go. So that's a life skill that has been helping them and empower them, because normally these ladies were not moving from 2 miles area around their home. So they were just going to the Walmart, to maybe George's and to Kruger's, but they were not going any other place besides that. We celebrate their birthdays. We celebrate their holidays that we have in Latin countries, like our Independence Day, that it was on September. And we have healthy fun exploring Fort Wayne. We have gone, for example, I have a slide over there showing we are there in the YMCA of Renaissance. These ladies never has been in a pool. These ladies never has been, maybe 80% of them, inside the gym or in the water. So then, and we did that there an aqua, low, and arthritis session. So so then we are trying to do so much for these ladies, and they are appreciating. That picture over there, that slide, is about when we took them to China Lakes. So then, and that was a wonderful day. And all those activities help them to release stress and to increase their their self-esteem. Other services that I provide clients is case management. I provide just emotional support. I listen, I validate their feelings. I refer them to other social services agencies. I help them with job search and to make the resumes. I help them to fill in applications for medical financial aid, for hospitals if they have bills. I advocate for clients with other providers. I told to other providers about cultural sensitivity and awareness about why this person is like this, or why this client don't want to do this or that, and they are asking them to do. Can we move to the next slide, Felicia? Thank you. And this is a program that we run, we started on November, and it's a program that get over on Christmas time. It's named Best Christmas Ever, and it's a program where the Latino clients that are confronting hardship obtain gifts through being adopted by an agency, a business, or an individual. Donors gonna attend to meet the clients in person to give them the gifts in a Christmas dinner that we organize for them. And the clients cook the dinner. We do it in a church, and Santa Claus come to the party and is there for have pictures with the donors, with the families that are adopted, with everybody, and to thank the people for helping him in the job. If someone of you would like to sponsor a family or an individual, we have over there even couple ladies around 19, 18 that they are homeless. You can contact me to my email, which is mvaldez@hvusa.org, or call into Health Visions, and the phone number is 260-745-1600. My extension is 204. Thank you.
Oh, wait a minute. Okay, thank you so much, Lupita. As you can see, she is knocking it out of the ballpark in helping women in our community. I can proudly say that Lupita leaves nothing on the floor. This woman, I try to get her to go home sometimes, but I'm not able to. So she puts all of her heart into these programs. And so we wanted to share with you some of the great things that are going on, because I don't think enough people in the community know about this. As Lupita said, if you are wanting to help in sponsoring the families for the best Christmas ever, please contact Lupita, and she will connect you, and you can be part of some of the festivities and some of the blessings and services that are going on. So thank you, Lupita, for all that you do. We've got some wonderful comments in the chat. And so thank you all for your support in this endeavor. Now, any questions for Lupita? Real quick, anyone have any questions?
Yes, I would like to make sure that she get in contact with me, because we are doing a big youth and family empowerment initiative next year, and we want to include all families, especially Latino families, at the Boys and Girls Club. So I posted my phone number and email address. So I would like to sit down and have a talk with her.
Okay. Lupita, you see Joe Ayers' information there. So wonderful. We're going to move right along to our featured guests from Brightpoint, John, Robb, and Anne Adams. John and Anne, it's all on you. I understand you don't have PowerPoint, right? Okay.
Correct.
They are going to compel us now with some of the wonderful services at Brightpoint and how we can utilize those services during this winter season. Anne, Robb.
Okay, let me ask real quick before Ann starts here. I had sent in the Brightpoint brochure. Did that get distributed to everybody?
No, I'm sorry. I didn't realize you wanted me to distribute it.
That's what I use as my handheld PowerPoint. Yeah, that was what I wanted to have everybody be able to look at as I'm going through it. But
my apologies.
Be that as it may, we will get it. As long as you get it to them at some point, that would be great. And I'll turn this over to Ann, and she'll do her half a dozen programs. Then I'll jump in at the end and wrap up the rest of what Brightpoint is about. So go ahead, Ann.
Perfect. Thanks, John. We're going to talk about energy assistance, emergency repair and replace, weatherization, and childcare. So the Energy Assistance Program is a program that helps pay a portion of the winter heating bills, and it benefits those households with a combined income of 60% or below of the state median income. That program serves Allen County, DeKalb County, LaGrange, Noble, Steuben, and Whitley counties. And it runs from November 1st to May 15th, unless we run out of funds. So it offers gas, electric, and water benefits to these clients. It's going to pay some of the bill. It's not going to support them through the whole winter. How you can apply for that program is the easiest is through our website, which is mybrightpoint.org. And you can register for the link to the application there. Complete it, you upload your documents there, and then submit it, and then we process it. We have 55 days from when you submit that application to process it. You can also come by our office, Monday through Friday from 8 to 4:30 and pick up an application. You can drop the application off back in our office, or you can email it to gethelp@mybrightpoint.org. And you can also put it in the Dropbox. We have an outside Dropbox at the main office. It's the Brightpoint Information Center, and it's at the alley on Bar Street. Part of energy assistance has some other branches off of it. One of them is weatherization. You must complete the energy assistance application and be approved to get weatherization. Weatherization is where an auditor would come out to your home and provide you with an energy audit to see how they can improve your fuel efficiency, whether it be gas or electric, to see if they can improve that heating cost for you. There is a waiting list for that. We can only help so many families a year because that does take quite a long time. If they discover they can make your home more fuel efficient and it's cost effective, they would perform those services. They do those about 100 families a year. So that's weatherization. Another part of energy assistance is a program called Emergency Repair and Replace. It's also called ERR. That program is to help people whose furnaces aren't working, but there's some criteria that they have to have. One of the big ones is you must own your home. Your furnace can't be working, and you have to be either elderly over the age of 60, disabled, or be a child under the age of 5 in the home, or a veteran. If you meet that criteria, we would send someone out. They would assess the situation and figure out if they can replace your furnace or if they need to repair it. And we would do that to no cost to the client. Okay, so that's energy assistance in a nutshell. It's a great program for those low income families. Right now we have lots of applications. We have as many applications today as we did the whole heating season last year. So there's a lot of need out there. I'm going to talk about childcare and On My Way pre-K. And this is providing clients with a voucher for childcare if their income is below 127% of the federal poverty guidelines, which is the same guidelines that they have for food stamps and things like that. They have to be working, going to school, or job search to get on this program. Children who are 4 but not 5 by August 1st can qualify for On My Way pre-K. With On My Way pre-K, there's limited eligibility, and this offers the On My Way pre-K program to those families who get SSI and who have an income that's higher than the 127%. That eligibility would go up to 185%. And that gives them On My Way pre-K for that program year. They wouldn't be able to transition into childcare after. They would just get that 1 year of On My Way pre-K. And I'm going to pass it over to John.
John, it's
You're
Sharon.
muted.
Oh, am I muted?
No, John is muted.
Oh, John,
gotcha.
would you like me to share your brochure? I can pull that up and share it.
Yeah, that
Sure.
was that's what I was hoping, so they could follow along, so to speak, or
There you go.
okay, there you go, great. First, I wanted to give a shout out to Denise over there. Where'd she go? You had oh, never mind. I'll do it at the end. All right. So again, my name is John Robb. I am the Family Development Program Manager at Brightpoint. I manage case management and our housing programs. And this brochure you're looking at is what I work off of instead of a PowerPoint, because normally I really prefer doing these in person, but of course COVID ended that for a lot of us. So I'm hoping to get back to that. I like sitting around the table talking to people and seeing faces, matching them with names and things. So, but again, real quick, Brightpoint is what is called a community action agency. What we are Brightpoint doing, or Community Action of Northeast Indiana, doing business as Brightpoint is our title. The community action agencies, for just a quick bit of history, were started in the 60s by President Johnson as part of what we know as the War on Poverty, for those of us old enough to remember that. And what basically a community action agency is, the idea being that programs, or that the communities know what's better for themselves. They know what their problems are, versus an ultimatum from Washington, D.C. saying, you need childcare, you need this. They supply the funding for us, and we kind of create programs as we think our community needs them. So Anne touched on some of our programs. I'm going to jump into the rest of these. On the left here, covering kids and families. One other thing real quick. Somebody was very smart when they set up our system, that to get a hold of anybody, it's their name, their email is their name at mybrightpoint.org. So mine, for example, John Robb at mypoint.org, or Ann at the same thing, same process. So any names I give you, you can get to these people by that email. And also, I'm going to throw a lot of information at you here pretty quickly. So if next week you have to rethink this stuff, feel free to email Ann or I to get clarification or get you pointed in the right direction. Okay. So again, starting on the left, covering kids and families. It is it's basically to get people signed up for insurance. Started with the Obamacare programs back in the day. And as it says there, it can help you hook up with Medicaid, Who's Your Health Wise, Healthy Indiana plan, and that type of thing. Even if you've already got it, you can come in and have it looked at, see if there's something different you can do. But that would be a great program for people not having health insurance. Skipping down to supportive housing. That's one of the programs that I run. There's two parts of supportive housing. Housing choice voucher, which is known as Section 8. And then permanent supportive housing. The housing, what a lot of people don't realize in this area is that a housing choice voucher, AKA Section 8, is handled in the city of Fort Wayne by the Fort Wayne Housing Authority. Brightpoint handles it outside of the city of Fort Wayne and in the 6 counties in Northeast Indiana, as well as Elkhart. In Elkhart, the city of Elkhart and Goshen, again, have their own housing authorities, so we don't work within their city limits. The really cool thing about that right now is that we have opened our waiting list after years of it being closed. It is an online application for the waiting list. It is not a quick fix for housing, if that's what you're after. But the idea is to get people back on the waiting list. It could still take a couple years, I kid you not, to get it, but you never know where you're going to be at a certain point. And we've basically purged the previous list and are starting over. So it behooves anybody with housing instability to apply. The website for that is, again, www.mybrightpoint.org/HCVP. Or you can go to our website and there's links to it there. You do the application online. Again, it's an application for the waiting list, not for direct housing. So again, feel free to apply for that. Also under supportive housing is what's called permanent supportive housing. Very similar program, but it targets people with mental illness, substance issues, and or AIDS. It's specific to that population. That process to get into that is through what's called coordinated entry. If you've not, I'm going to try to do this briefly, but feel free to follow up with me if you are confused. But under supportive housing here, permanent supportive housing that I mentioned, and then over here under housing solutions is about 3 or 4 more housing programs. The thing about these programs is that they need to be assessed through coordinated entry. The good thing is Brightpoint is the coordinated entry resource in what's called Region 3 of the continuum of care. basically Northeast Indiana, the 10 or 12 counties in Northeast Indiana. We are the go-to place for coordinated entry. How you get to coordinated entry is you call our number, 260-423-3546, go to extension 332. Again, that will get you in for a possible, or for a coordinated entry assessment. And we also created that line. It's not manned, it is strictly a message phone that for any people with housing issues, either rent issues, and that type of thing. Now, what coordinated entry does is it assesses your level of homelessness, which may sound weird, but there's homeless sleeping on your mom's couch, and there's homeless sleeping under a bridge, and all kinds of things in between. So what coordinated entry does is assess your barriers and your level of homelessness and assigns you to the particular program that may fit your situation. So that is what basically supportive housing, housing solutions, and coordinated entry is about. Again, a lot of information. Feel free to get back with me if you have a concern. Family development is one of my programs. Also, it's our original case management program. I will be honest with you, we have kind of put that on the back burner because the housing solutions, since COVID started, housing and homelessness has been our #1 topic, basically. Paying rent for people, we've got some programs that can help pay rent. We've got mainly it's people that are homeless. When COVID took everybody's job away, couldn't pay their rent. Then of course the landlords couldn't evict, and they could evict, and all that mess. So that's kind of been our focus since 2020, is basically housing and that type of thing. Coming down a little farther, supportive services for veterans families. That is one of our biggest programs as far as range. We covered 26 counties with that, basically from South Bend over to the Ohio line and down to Muncie area. It is a short-term kind of get back on your feet type thing. It is VA funded. We do work really closely with the VA homeless team to sometimes they can, something doesn't fit well in their world, they send it to us and vice versa. The VA has what's called HUD-VASH vouchers, which are basically Section 8 vouchers for veterans, which they issue to veterans that meet the qualifications for that. The one thing I wanted to say about SSVF being a VA program and some of these other housing programs I have, the reason we have to run people through coordinated entry is because if you are receiving HUD funding or VA funding, you must have a coordinated entry process. And we've had one since 2017. And that's how, again, we get people into these programs for housing. Let's see, moving over to youth and youth development. We have early Head Start, which is birth to 3, Head Start 3 to 5. Those are, I think most people have heard of Head Start. It is more than just daycare. It is daycare, true, but it also has, early Head Start has case managers that work on the things listed there. And Head Start has a lot more programs, education, health, nutrition, social services. We work closely with all these programs. When they have families that have issues, they come over to us. And if we have kids that need to be in Head Start, we refer them over. So it's nice to have a lot of these things at our fingertips. Sharon, how am I doing on time? All right, we'll keep moving.
Sorry, I was muted.
That's okay.
Yeah.
We'll keep moving until you
Just a couple minutes. Just a couple minutes.
All right. JAG is our youth program. It is in about, I want to say about 12 or 15 high schools in the area. JAG is Jobs for American Graduates. It's basically a class on certain kids' curriculums, kids that get referred to JAG. The focus of JAG, excuse me, is to, #1, graduate high school. That is the #1 issue there. #2 is, what am I going to do when I grow up? What am I going to be? Am I going to go in the service? Am I going to be a plumber? Am I going to go to college? JAG helps kids work that out, figure out what works for them financially, emotionally, what they can handle, and points them in the right direction, basically. If you can continue on to the right there, under the kids, there's our basic Head Start locations. Some of these should be, again, I will preface this whole brochure with some of these places may or may not still be in working. I don't think we're at Abundant Life anymore. I do not recall. Some of these things have changed, but you can always call into either myself or Ann for what she talked about, what I've talked about, and we can always get you into the Head Start people if you have questions there. Sharon, can you get to the back of the brochure by any chance? Brightpoint is involved in a number of, there we go. There's our local offices on the left. And I think all of those are still up and running. They are not, sometimes they are not open every day. They're open a couple days. Again, we've all got staff problems or staff issues. So, but if you call these numbers, you call these offices, it will, at worst case scenario, it'll get into us, it'll rotor back to the main office. Community investment, some of the things we do, poverty simulations. We have a program for small business loans to help people start up small businesses, financial education, housing rehab. We haven't done that in a while. We used to buy some homes and remodel them for families. I don't know if people are aware that Hopewell Point out in Waynedale is one of our projects. We just opened up Enterprise Point up in Angola. It's an apartment complex, that type of thing. This community loan center is a arrangement we've got with some businesses here in town that their employees can get small loans. You know, you need a water pump on your car for $300, $400. You can get a loan through your company through Brightpoint, and then it gets paid back through your payroll deduction type of thing. Oh, there's Enterprise Point to the left there. So this was a apartment setup we've built up in the Angola area. So again, I feel like Ann and I have thrown a lot at you. Feel free to email either of us. If we can't get you the answer, we will find the person that can, okay? And anybody, any other agencies online, I do these things quite a bit for the organization. Ann was kind enough to help me on their specific area on the first floor when you walk into Brightpoint. So feel free to contact us, and it was a pleasure and appreciate you contacting us to talk to you. Any, Sharon, I'll let you open it up for questions or whatever you wanted to do.
Thank you, Rob, for that. And thank you, Ann, as well. Do we have any questions? That was a lot of information. And if you haven't already, Ann and Rob, if you could put your email addresses and the website for Brightpoint in the chat, that would be helpful so people can see it as well as hear it. Some of us are visual. And we can contact you. What questions do we have for Ann and Rob? Denise has got her hand up. Denise, you're on mute. Okay.
Yeah, okay. I have to say publicly that John Robb taught me how to be a case manager.
Wow.
Back in the, golly, it wasn't even the Obama days. It was in the early days of the, it was the last years of the Bush administration. And we thought we were, that the economy was tanking and jobs were going through and the mayor was cutting staff and everything. I learned how to look at the other side of the picture in the community because of John Robb, and I want to thank him. And he never retired, so I guess I still have to keep working.
I'm getting close, Denise.
You told me that 20 years ago.
It'll be close. I appreciate that, and you who I wanted to give the shout out to. It was nice seeing your face on here again. And I don't know if I did all that, but I know we sat around a lot of tables.
A lot of tables, a lot of talk, and getting people together. We actually created the what was it, Social Service Summit, where organizations came together. We didn't have Zoom. We didn't have the opportunity to do anything virtually, but we brought about 50 agencies together at the out Southtown Mall, Public Safety Academy.
Yeah.
People could have their tables, but we could get together to discuss the issues, come up with solutions, how we could work together. And then, you know, we did that several times. We did that for immigration issues that were going on. And I think it's something that Health Visions in this collaboration might want to consider as we go forward, because Fort Wayne after pandemic will never be the Fort Wayne we were before. but we've got to figure out a better way to work together to get these problems. If we can't fix them, at least not make them devastating for as many people as they are.
Thank you, Denise. There's a lot of wisdom and institutional knowledge, just even on this call. So we appreciate all of the work that you all have done and continue to do for this community. I see a question in the chat from Kim Eldridge asking who was speaking. I believe she's talking about you, Lupita. Would you mind putting your name and email information in the chat? Yeah, put that in the chat. That was Lupita Valdez with Health Visions. Okay, Diana is saying, Dr. Diana is saying that she goes way back with you as well, John. I saw a hand up somewhere, but I'm not seeing it now. Was that Marquita? Does anyone else have a question? Let me say that. Any more questions for John and Ann with all the work that they do? Oh, Marquita was clapping. Okay, wonderful.
I don't have a question.
Yes. Uh-huh.
Oh, I don't have a question, but I wanted to say we started the small business loan program, and I think it's been like a month, and I think we have 8 employees who are utilizing it already.
Oh,
it's a great program, and yeah, it's really helped, especially around Christmas when we started it.
Thank you so much, Ann. So yeah, there are a lot of things that Brightpoint is doing. It's hard to keep track of all the stuff that they're doing, and all of the different ways that we can refer people to Brightpoint for various assistance that is so needed at this time. We will be sure to get the brochure out through email to everyone on our serve list in our follow-up email. We do send out a follow-up to these meetings, and we can attach the brochure there. Okay. Any other questions or comments about Brightpoint? Okay. Marquita is saying an amazing force in the community. Yes, indeed. All right. Well, if there are, go ahead, John.
I just want to say thank you all for letting us talk, and nice to see some friendly and familiar faces. And we're all out there doing a lot of heavy work, and it's all appreciated. I know we don't always talk to each other, but we're all in this together.
Thank you, John. And we appreciate you sharing your information with us this morning. Now we will move on to partner information and partner sharing. Anyone have anything that you want to share? We switched the agenda around a little bit, and so Lupita did a lot of the sharing for Health Visions. I don't think we have anything else. Do we, Felicia, that we need to?
The only thing, just to, everyone, please put on your calendars, is our open house. That will be on January 25th. It is on your agenda, but I just want to make sure you have it on your calendar, and that will take place in place of our usual January meeting.
Okay, so we will finally open up our doors. We've been open, but we're going to have an open house. We'll do a presentation. We'll have some activities. Also, we will not be meeting December. We figured you all probably wouldn't come, but we won't be meeting in December, but we will be sending out some information by email about the Allen County Health Equity Coalition and membership fees for 2023 and what that is going to look like. We're hoping to do some exciting things next year. Now, anyone else, what's going on with your organization, your coalition? What do we need to know?
Hi, Sharon, it's Kiona. For me, I have a Christmas tree craft coming up on Wednesday, December 14th at the Impact Center from 5:30 to 7 p.m. So we're just going to do a Christmas craft, and you can decorate your house with it, bring it back home and just have a good time and just kind of relax and have some fun with it. And then just to let you know, because I know it's not on December's postcard for us for Cancer Services, but we're still having our personal training, or we changed the name, Stretch and Strength on Tuesdays with Linda Thiem from 2:30 to 3:30, and Diane is still with us on Thursdays for chair yoga from 2:30 to 3:30 as well. So
Kiona is with Cancer Services of Northeast Indiana. So those events are events through Cancer Services. And we will be sending out a news and events calendar. We send that out when is the next one coming out, Felicia?
I'm hoping to get it out on Friday.
Okay, so send us your events, your news events, and we will put it in there and
Sharon,
send that out to everyone.
I'm sorry, Sharon, and it is free. You do not have to have cancer. It is open to the public. So thank you.
Okay, great. I see a couple of questions in the chat. Felicia, could you answer Kim Eldridge's question about the open house and those things in the chat?
Yes.
Who else has some information they want to share?
Hey, this is Diana. This is not local information, but it's more of a personal thing. Just to let you know that I don't know if anybody's been following the news of what's going on in Nigeria. The floods have displaced about 1.5 million people. And unfortunately, my family relatives have been impacted a lot on both my mother's side and my father's side. My father's village, has lost everything. We've been flooded out, and I started a fundraiser for the village, which is going to continue to 2023. So if anybody's interested in supporting me, I can send you information about it. It has been terrible. So we are trying to get supplies to them. People have lost everything. And as I said, my family, relatives, I should say, have lost everything. The village is actually underwater right now. It is just it's terrible. And my cousin who works for the Nigerian embassy in Washington, DC, actually took a trip to see how much damage. And she says it's just devastating to see. They're unable to get to people. The only way you can get through is by the canoes, the little boats, to get food to people. And so the fundraiser that I'm doing, like I said, is going on until probably till January, because it's beyond something that we're doing just for Christmas. We just think it's just trying to get even just tablets so that we can get the water tablets, so that there's fresh water for people to drink, so that they're not just drinking the water and getting infected or drinking poison, because the water is now contaminated, and just getting food supplies and clothing. And so I'm hoping to get a lot of clothing even shipped to Nigeria so we can get it to the village. It's absolutely devastating. I was working on doing 2 villages, but when I spoke to my mother, who is working with a local church in Warri, which is about 2 hours from where this flood happened, she says, no, you really need to focus on your dad's village because they took the worst hit. So if anybody's interested in supporting me, I'll just send put my email in the chat. Please feel free to reach out to me.
Thank you so much, Diana, for that. We know that, or some of us are aware that you do work with Parkview in the Diversity and Inclusion Department. I'm not sure that what you are saying is a Parkview thing, right?
No, it's not.
Okay, that's why you didn't identify yourself as from Parkview.
Yeah.
This
is not a Parkview thing.
Yes.
This is a personal thing, because it really did affect my family. But my goal is not to help just my family, but to help the villagers. We have a little over 100,000 people that are all in camps right now.
Okay. Thank you so much. We are sorry to hear about that devastation. And please, if you are in a position and would like to help, please connect with Dr. Diana. Okay, anyone else have some organizational news?
Yes, I do. Hello.
Yes.
Hey, how everybody doing? First, I want to let Diane know that I got 2 storage rooms full of clothes, summer clothes. I know anytime that you want to come out, or I'm over here at the Family Life Center now. to where when you're ready to ship some clothes out, I got summer shoes, I got sandals, I got shorts, I got women clothes, kids clothes. So whenever you want to start thinking about shipping clothes over there, please contact me and I'll make it happen to where you'll have enough clothes to take to your family and your people.
Okay, thank you so much.
Okay.
Awesome.
Yeah, I got 2 storage rooms full of clothes. So also too, I want to just make a couple announcements right quick. I am doing 2 clothing holiday giveaways this year. On December 10th, it's going to be at the Family Life Center on Reed Street, across the street from Hannah Villages. It's going to be from 12 to 5. And then on the 17th, it's going to be at the Urban League from 12 to 5. Also, too, I'm working on getting some Christmas toys for the kids. I gotta wait to get that confirmed. But also, too, I want to invite all these organizations out. Harris Community Outreach, the Boys and Girls Club, and Indiana Black Expo will be doing a youth and family empowerment initiative April 15th at the Boys and Girls Club. And our goal is to bring out resources, have panel discussions, have breakout sessions. So could you please contact me and I will give you more information as we move forward. This is going to be an awesome event as to where we want to try to get be able to pay people rent and bills. We want to have just be able to talk to the youth, you know, to open up to where we could really communicate and with these families. These families are really struggling with these young people because they're not connecting. So we want to bring that connection back in with the family. So that's April 15th at the Boys and Girls Club.
Thank you, Joe. And you're with Ayers Community Outreach.
Yes.
So yeah, for some people, please identify your organization that you're representing. Kim, I saw that you had your hand up.
Yes. So if your organizations need any emergency diaper support, I'm going to put this email in the chat. Feel free to reach out. And Michaela is our intern over at Shepherd's Hand. You can see that I'm at Shepherd's Hand, but also at Adams Health Network as well. And so for Shepherd's Hand, though, Michaela will be able to meet you and will be able to supply emergency diaper support for your clients. Our next health fair is in February. And so certainly feel free to reach out also if you're interested in having a table there to share about the services that you provide as well.
Thank you, Kim. We've got 1 minute and 30 seconds. Anybody else? I see no one forthcoming. We've had we had a few new people on today. I am sorry I didn't get to my introductions of new folks because we had so much on the agenda. But if anyone in our remaining minute, if you are here for the first time, if you could just give a shout out of your name and organization that you are representing.
Hi, this is Kim Eldridge. I'm with United Healthcare. I'm the state event planner. I'm here for Tamika Saunders, who's our community relations specialist. I fill in on some meetings for her when she's busy, but I just want to let everybody know that our program is Hoosier Care Connect. The Hoosier Care Connect program is a Medicaid program that covers people with disabilities, especially seniors with disabilities, people who are blind or aged, also with disabilities, and then foster children in wards of the court. So that's our program, and we are always available to partner with different organizations if you need for us to come and explain the program to your people, or to just have a table at something that you're doing. Just please let us know. I'll put my information in the chat. Thanks.
Thank you, Kim from United Healthcare. We appreciate that. Anyone else here for the first time?
Yeah. My name is Camille Schulke. My name is Camille Schulke. I am the greenhouse farmer for the Parkview Community Greenhouse. So my background's in agriculture, so I'm here to learn a little bit more about what's going on in our community and how they can be of help. I particularly grow produce in partnership with the Heal Market, with Health Visions, also with partnership with our dietitians who do No Kid Hungry and things of that sort. So I'm really seeking to learn what's going on and learn from all of you. So thanks so much for all you do, everyone.
Thank you, Camille. I see a couple of people have introduced themselves in the chat. Carrie from Greater Heights ABA, a care coordinator there. Thank you, Autumn, Purdue Extension, letting us know about an upcoming networking events called Morning Coffee on the second Friday of the month, starting in January. So wonderful. Please email autumn@astrice@purdue.edu if you're interested. Anyone else here for the first time?
Hi, yes, my name is Juanita Boland. I'm the new director at Health Visions Midwest in Hammonds. And so I'm really glad to be part of Health Visions, but also to be joining the Allen County Coalition today. So I know we have up in Hammond, I think I have a whole week under my belt. As I'm getting a little bit more acclimated, I definitely am looking forward to doing something similar to this, where we're able to hold our own kind of coalition meetings and things like that to stay connected. But just being on today, I was able to gather so much information, and we'll love to connect with people to see what we can bring to Lake County as well.
Wonderful. Juanita is my counterpart in Lake County. Thank you, Juanita. We have just a couple more people. Lisa Wells, Care and Risk Management Coordinator at Neighborhood Health. Thank you for joining us today. Marquita with Anthem is talking about her role as a member support. I thought Marquita had been on before. Oh, no. This is another Marquita. Okay, I am sorry. I was thinking of Marquita. Okay, yes. Her role as member support with Anthem, currently not work. Okay, great. Thank you, Marquita, for joining us today. Anyone else? John Miller, his internet keeps coming on and off. He's got a new program manager. He's a manager with Alzheimer's Association serving North and Northeast. Yeah, thank you all for coming on today. We appreciate you. We thank you. And hopefully we will be learning some new things from you in the coming year. In the meantime, happy holidays, Merry Christmas, Happy New Year, Kwanzaa, all of the Hanukkah, all of those things. So we appreciate you. Thank you. Have a wonderful holiday season. And remember to think about what is most important and how you have been blessed this season. Thanks, everyone. See you in January.
Thank you all.
Bye-bye.
Bye.